Hello everyone and welcome to Inside Healthcare. Back and neck pain are among the most common causes of pain, often resulting in surgery. Now there's a brand new back and neck clinic in the Twin Cities that offers alternative treatments to surgery for your back and neck pain. Here's a video, virtual tour of this new facility and more information about it. Let's take a look.
My name is Matt Dodd. I'm the clinic manager of the HealthEast Spine Center. I've been with HealthEast since June of this year, so going on about 3.5 months. My background was I was previously a family practice clinic manager, and I have some neurology background as well. So I'm really excited to be part of a specialty clinic. We're a brand new facility here in Maplewood. We have 3 providers, one physician, Dr. Jennifer Kendall Thomas, and 2 mid-level providers, Elise Fox, a nurse practitioner, and Marlon Gilbert, a physician assistant who is also a doctor of chiropractic. What we really want to do with this center is to exceed a patient's expectations and give them an experience that they've never had before. We do this by everything that has been done here has been absolutely intentional, from the chairs that patients sit in to the color of the walls that they see in their rooms. We want to exude a different type of calming experience for them. We want the whole experience to be a center without feeling like a center. We don't want it to feel like a clinic. We want it to feel like something different. In our main lobby, we have blue rock with lights that mimic a waterfall, again to really bring out a calming influence in our patients. And we're also very intentional with what we named rooms. We wanted to not describe what we do from a clinical perspective, but to really create the patient experience. So it's not called a physical therapy gym, it's called an activity center. Again, to describe what the patient, from the patient's perspective, what is occurring there. Well, we take pride in really connecting the loop between inpatient and outpatient care. So oftentimes patients fall through the cracks, and we want to make sure that that doesn't happen. One of the unique things is we have a spine navigation department. So we have an intake specialist and we have a care navigator who, from the moment a referral comes to us, they are with them every step of the way. And throughout the whole process, we have a nurse navigator who walks with the patient every step of the way to make sure they're not forgotten. Here at the Spine Center, we have the patient, when they're done with their clinic visit, our CMAs and our clinical staff walk with every single patient out to the lobby. They do a warm handoff to the receptionist, and we always ask, is there anything else I can do for you? And that's unique. You don't find that everywhere. Our vision is to redefine spine care, to become the #1 choice in the Twin Cities metro. That is our vision. And so we don't want to just meet patients' expectations, we want to exceed them. And we want to give them the type of experience that they cannot find anywhere else.
And the HealthEast Spine Center is located in the former Gander Mountain building near the Maplewood Mall, just off of I-694 in Maplewood. Well, if you or someone you know recently had a baby, you may be aware that more and more moms are choosing to have their babies delivered by Waterbirth. Still ahead, we'll tell you about the latest hospital that has now opened a Waterbirth suite, so stay with us.
There's a place, not so far away, a place where you don't have to keep the volume down, or clean up your room, a place where you don't have to make time for free time. You don't have to do anything but show up. You'll find all sorts of creatures in this place without have to. The silly you. The proud you. You may even meet the curious you.
Tickling me. You!
There are lots of yous to catch up with. Ask your parents to take you to this not-so-far-away place. Come to the forest, where the other you lives. But first, stop by discovertheforest.org.
Welcome back, everyone, to Inside Healthcare. As I mentioned before the break, more and more moms are choosing to deliver their babies by water birth. St. John's Hospital in Maplewood is the latest Twin Cities hospital to open a brand new water birth suite. So now let's take a look at it.
This is an option that we've never been able to offer at St. John's, is this very neat, new to us, way to deliver a baby. We're very excited that we have a water birth suite at St. John's, and it's in an effort to create the whole realm of options for the laboring mom and her family. It's actually become the standard in Europe for many, many people to deliver in water birth tubs. We have your standard birthing bed and a fetal monitor for monitoring baby's heartbeat. We have a computer for nurses to chart on, and then we have a lovely water birth tub. It actually holds 90 gallons of water, and it's 6 feet long on its inside, so there's space for a mom to be in that water, regardless of how tall she is. It has lights in it, so the area of labor and delivery can be illuminated at the right time. And this tub actually has water sanitizer, so it's constantly changing out the water and sanitizing the water and keeping it at the right temperature for mom and baby. So it's much more comfortable, is what mothers tell us after they've had a water birth, that they really like the pain relief being without medications or anesthesia. Babies that are being born in the water really do have great outcomes. The HealthEast nurse midwives do water births with their patients, as well as the Generations nurse midwives who all deliver here at St. John's. They also deliver at Woodwinds and at St. Joseph's. She'll need to be a low-risk patient without any of the concerns of high blood pressure or prematurity. There is an extra charge for water birth, mostly because nursing will stay at your side the entire time you're in the water. We think that people will enjoy it.
Wow, what a beautiful, beautiful little baby there. So to tell us more about this water birth suite at St. John's and to tell us all about water births, we're pleased to have back with us Peg McCoy. She's the director of the St. John's Maternity Care Unit. So thank you, Peg, for coming back. And Melissa Hassler, she's a certified nurse midwife. So again, it's always nice to have you guys back with us, so thank you so much.
Thank you.
So Peg, why don't we start with you? Obviously, St. John's Hospital has been around for over 100 years, been delivering babies, maybe not back in the early days, but recent times. They've delivered thousands and thousands of babies.
Yes.
Why have a water birth suite? Why open one now at this time?
We are committed to our patients and their families, and we always want to make sure that we're providing the best care every patient every time. So patients are asking, as are some of our providers, the HealthEast nurse midwives and Generations nurse midwives, were asking us to kindly build them a water birth suite so we could provide this kind of care for our patients. So we really worked hard at providing that, and we're real proud of the way it turned out.
And it's not like you just put a tub in the room and then you're all set, right? There's a lot more to that. What was all involved with getting a water birth suite to open?
Oh, we had to completely deconstruct a room and reconstruct a room to
Wow.
just to do the plumbing as well as the design of the tub and having it fit with the design of our unit. We really feel great about how it turned out. We think the aesthetics and the colors provide a restful, healing atmosphere for moms and babies for a joyous time.
I was fortunate to work on that video, so it has that spa kind of a feel to the whole room. It's just awesome.
And our patients deserve that.
Yes.
Our patients deserve that.
They certainly do. Melissa, in the video we were talking about a gentle birth. What are the benefits? Why do you call it a gentle birth? What are the benefits to having a water birth?
Anyone who's seen a water birth, that's the only way you can describe it, as a gentle transition. It's pretty quiet. The baby is going from in the uterus, which is filled with amniotic fluid, transitioning into another water environment. The water's the same temperature as the uterus, and so the baby doesn't receive this shock of cold air. It doesn't receive the stimulation of the air at all. It just transitions out into some water. And it's amazing to see. You see these babies under the water right after they have been birthed. They're not breathing yet because they're under the water, but their eyes
there's
are...
no concern about drowning or anything
No,
like that?
no. It actually, the stimulation to take your first breath comes from the change in the air pressure. So as soon as the baby comes out of the uterus, that air, when it hits air, it takes its first breath and then cries. So if it's transitioning from the intrauterine environment to the water, it's not stimulated to take that breath. And what you actually see for the first few seconds to a minute after birth is this baby in the water, opening its eyes, looking around, watching what's happening, and then you slowly bring it out of the water up to the mom's chest. And so that gentle transition from the uterus to the water is so peaceful for the baby that when it comes out, you usually don't hear a scream or a cry. It's usually pretty quiet. And then we, as nurses and as midwives, we like to hear the babies cry to clear their lungs and their airway, so then we stimulate things a little bit and get them to cry. But it's very peaceful. And for the mom, she doesn't feel quite as much discomfort as you would feel out of the water, because you can change your position better. And you, the warm water helps the blood flow a little bit. So then that baby, or the laboring mom in the water, feels more comfortable. And so it's a little bit gentler for her body. Her tissue expands better. Her muscles work better. She moves easier. And so that whole process is just a gentler process for both mom and baby.
So who can, in the video we talked about that you want a low-risk pregnancy, but what would be some of the other criteria? Who is a candidate, I guess, for a water birth?
You know, we like to offer water for all of our laboring patients if it's appropriate, but there are some people who really shouldn't do a water birth. If you have any medical condition, Peg had mentioned high blood pressure. If you have significant conditions during your pregnancy that require intensive monitoring, such as bleeding or medication to stabilize your body. And there's a whole list of things that we go through antenatally to make sure that our patients are appropriate for water birth. But really, medical complications or complications with the baby in utero are reasons why we would not do a water birth.
Now we know that sometimes complications can come up during that labor and the delivery. So let's say someone is a candidate for it, then during the labor or the delivery they start having complications, they would come out of the water then?
Exactly. That's one of the great things that St. John's had set up when they designed this water birth room, is they had safety in mind. And that's always everyone's priority. We want to deliver a healthy baby and a healthy mom. And so part of our planning included not just the water birth tub, but the safety aspects of having a bed very close by, so that if for some reason the mom became too high risk to do the water birth, or if the baby in utero became too high risk to have a water birth, we make an easy transition. We step right out of that tub and get mom to the bed. Sometimes it requires some staff assistance or some partner assistance, because laboring moms can be challenging to move at times, but we're all trained in how to exit the tub in an emergency, and we've got all of our emergency equipment there. We've got oxygen, we've got fetal monitors. We're very close to any sort of OR if we need it, an operating room if there's some sort of emergency. So we've thought all that through, and we've got it down pretty pat. We've been doing water births at HealthEast for about 12 years. So we kind of have the roll down, and we know what to do in an emergency, and we make that transition as easy for mom as possible, getting out of the tub and into the bed.
You described a little bit about the baby itself during the water birth, but how about, can you take us kind of through the whole steps from, let's say someone comes in, they want to have a water birth, what happens?
So once a laboring mom is admitted to the maternity care unit, we do a couple of things to make sure she's still a good candidate. We make sure that all of her lab work that was done antenatally is available for us and is normal. And then we do blood pressure checks and basic vital signs and listen to the baby on the monitor, make sure baby's still doing okay. And if all of that checks out okay, then we go ahead and get mom into the tub once she's in active labor. And active labor is different for many different women.
I was just going to ask what would that be, yeah.
Yeah, usually when the contractions are regular, consistent in changing her cervix. So she's in a stage of labor where she's really needing some sort of comfort measures, needing that water to help her get through contraction to contraction. Part of the drawback to having only one tub is that we have to be good about timing when moms get in, so we like to reserve that water birth suite for the moms who are really closer to delivery, so in active labor. Once we've determined that, then we go ahead and get mom into the tub, and she can stay there, she can get in and out, she can change positions, she can do whatever makes her most comfortable in that moment. And then she pushes in there. And the provider, one of the midwives, or some of our family practice doctors do deliveries in the water. The provider who's at the bedside or the tub side reaches their arms in to help support the mom. We don't get into the tub ourselves, but we help the mom push. Sometimes partners are also in the tub, so if a father or a birth partner wants to be in there with the mom, there's enough space to accommodate. If the mom wants that, of course. And then the mom goes on to push, and we can change positions for pushing. We can bring in some tools like birth stools, squatting, all sorts of different positions to try and help that baby come down. We do help support the mom's skin in the bottom as the baby's starting to be born. And then the head is delivered. Sometimes moms like to assist with that, or the partner likes to assist with that. And the midwife or the provider helps deliver the shoulders. And then the baby comes out, and we slowly bring it up to the surface. Usually it's recommended from a few seconds to a minute. The minute's the longest that you really want to stay under the water to make sure that baby's doing okay. And then you bring it right up onto mom's chest. And the baby stays up on the chest for a few minutes, usually until the cord is done pulsating, because once that's done, that means there's no more blood flow going to the baby, and it's a good time to cut the cord. We cut the cord, we give the baby to either the partner, or sometimes the mom will hold on to it. But then we do need to get the mom out of the tub for the delivery of the placenta. And once she's out of the tub for the placenta, then she goes right into the bed that's right next to the tub, and we do any other repair that might be needed or any other stabilizing of the mom.
Wow, awesome.
Yeah.
I just can't imagine how lucky you are to be able to be a part of all of that.
It's
to see
gift.
a baby born, Peg, what about if someone's watching this who's pregnant or thinking about getting pregnant, and they think, I kind of like that idea. So how do they go about scheduling, lining up for a water birth?
Well, it's really the provider that you choose is going to have everything to do with if you can have a water birth or not, because providers need to be certified to do such a kind of birth. So the HealthEast nurse midwives can do that. The Generations nurse midwives can do that. And I believe there's a few of the HealthEast family medicine physicians that can do that as well. So I would start with my provider and explore that with them and get recommendations. If they don't provide that service, who can?
How many babies have been born there yet since it opened up a few weeks back?
7.
7.
We've had 7 babies born in the water. And the patients all told us that they just love the experience, and the nurses told us that they love the experience. I believe that what's great about this is everybody has won. The nurses love it, the patients love it, the providers love it, and so it's truly family-centered and patient-centered.
And I understand the first couple that delivered the first baby that was born, they're from Minneapolis, South Minneapolis, I believe even, so not even near St. John's Hospital.
Right, they made the choice. They wanted to have a water birth, and then they got to be the first, so that was very exciting for them and us.
So if someone, where can they get more information about the water birth suite at St. John's, or just about water births?
You can go to the website, the St. John's website, through the HealthEast website, and then you could see the virtual tour of the maternity care center as well as the water birth suite, and the information on what you need to do to get in touch with someone who performs a water birth is there as well.
If they have more questions and stuff. And what about, Melissa, what about if they wanted to meet a nurse,
Sure.
midwife, how do they go about doing that?
We've got a couple options. They can use the HealthEast website, and if they put in the search engine midwives, they can be directed to our page. But we also have a phone number that's specific for the midwives. It's 651-232-0005.
And one more time, the number?
612-232-0005. And that will direct you right to our scheduling team. And if you're just interested in asking questions, we'd love to talk to you. And there's no commitment involved. We can screen you with some questions. You can ask us questions. And we can even set up a meeting to talk more about it if you'd like.
Final comments in these last minute or two that we have left about Waterbirths, about the Waterbirth Suite, Peg?
I would say that Waterbirth is new to us, but it's not new. Waterbirths are very common in Europe and are becoming more and more common here in the United States. And when we started talking about Waterbirths, I did some research because I wanted to know for myself, and found that it's a very safe, wonderful alternative for patients, and that there's no reason for the right person to have a water birth. No reason why they shouldn't.
Mm-hmm. Melissa?
I think it's a real gift that HealthEast has given to the women who are planning on birthing babies in the Twin Cities. It gives them another option and another safe option to be able to birth their baby. And it's now really about choice, consumer-driven choice. And I think that HealthEast has really stood up and said, we're committed to that. And not only do we provide water births at Woodwinds and St. Joe's, but St. John's now it's really providing our patients a lot of options. And so I think that's a real testament to where HealthEast values are and supporting the community and the women that we serve. So,
well, we appreciate you both coming on and telling us all about it. Very exciting news, especially for our pregnant moms in the viewing area. So thank you, Peg, for being with us.
Thank you so much.
It's always a pleasure to have you with us, so thank you.
Thank you.
And it's a pleasure to have you with us. We appreciate you joining us, and we hope you'll join us next time on Inside Healthcare. We'll see you then, everyone. Thanks.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.